Kia ora, welcome to tonight's Goodfellow Unit Webinar on Clinician Wellbeing and Managing Stress and Burnout. So I'd like to introduce our expert speaker tonight, who's Dr. Fiona Moir. Fiona has extensive experience in teaching and education around clinician wellbeing and self-care. And earlier this year, won the University of Auckland Vice-Chancellor's Excellence Award in Health, Safety and Wellbeing. So welcome, Fiona. It's a pleasure to have you.
Thank you. Thanks, Helen.
I'll hand over to you.
Okay, great. So thank you for tuning in tonight when you've worked a long, hard day, I'm sure, or you're about to if you're on shift work. And so we're covering an important topic. And I'm going to break it into a couple of chunks, really, into three main bits for people who like to think in chunks. So we're going to be, I'll just talk through my first slide in a minute, but what we're going to be covering tonight is stress and stress management, burnout and burnout prevention, and then just a few extra resources and how you can incorporate it into your day-to-day life towards the end. So I just wanted to sort of briefly let you know about my expertise. So health and well-being is one of the things that's the area of my PhD, and communication skills, which we're not doing tonight, and increasingly with Connect, I'm working to do some supervision skills with senior doctors and helping them to talk to junior colleagues, which has been interesting. So here are our three topics for this evening, and people have specifically asked me to cover worry. That's something that comes up commonly, so we're going to do a little bit about that. For everybody listening, you will be familiar already with some of these strategies, and there may be some other things that are new. So it's always an opportunity to refresh some things and to maybe pick up a few new ideas for yourselves or for colleagues. It's very useful to have skills that you can use or ideas that you can have for those around you. So I think it'd be good to start off with stress and managing stress and worry. I'm aware that everybody listening will be clinicians of some sort or other, a whole range of practitioners, so there'll already be a huge baseline level of expertise. So I'm not meaning to teach any grandparents of any sort to suck eggs, but here we go. So I just wanted to remind everybody about the way that psychological health works. And I think the stress vulnerability model is the easiest way to do that. I think this is the most helpful way to think about mental health and mental ill health. So if you think of it as being on a spectrum, on the side here you can see that all of us slide from being well to being more unwell at various points in our lives. And in fact, the New Zealand Mental Health Survey from 2006 actually said that there was 46% of us would be unwell at some point in our lives, so with a diagnosable condition. So it's pretty common. We slide up and down this scale. And then this bit along the bottom is our ambient stress. So this is your day-to-day stress, things that happen when you're at work or things that are preying on your mind, financial problems, just day-to-day things that happen to all of us. And then on top of that, we have our life events. So they get superimposed in a sort of peak of stress that adds on to our daily stress. So that can be something big like a relationship problem or a job change or, of course, someone dying. And these superimposed peaks of stress can make you go over that dotted line. So the dotted line is your resilience threshold. And a resilience threshold is an individual thing. It's a sort of multifactorial concept. It's got biopsychosocial elements. So for instance, my mother had postnatal depression, so my attachment would not have been very good with her. So I would have been born genetically with a lower resilience threshold than some other people. But then hopefully because of the job that I've done and the area I've gone into, I've learned over many years to increase that resilience threshold. And so the idea is that all of us can learn to increase our resilience thresholds so that ultimately you can, by the time you have your next life event, your resilience threshold can be very high because you will have another life event. We all do. And so the idea is that you really think about where your resilience threshold is. For some people, their threshold is very close to their ambient stress levels, their day-to-day stress. And you might be able to think of some times that you've been there, and that can feel pretty unpleasant and sort of emotionally fragile, I think would be a good way of putting that, when your day-to-day stress is right next to that line. So this is the main concept, I think, about stress and psychological health. And I know I'm spending a while on this slide, but I just wanted to put it at the start of the evening before people drift off to sleep or start cruising. So hopefully you've got that on board. Another equation I think is helpful is this is a way that you can define stress or distress, really, is when your demands are more than your perception of your ability to cope. And the reason that I've underlined these three things is that sometimes you can change one of these things, and in fact most times you can change one of these things. So this is a very useful equation to have as a problem-solving equation. You can apply it to a situation. You can be aware, I'm feeling stressed. Is there something I can do about the demands? Well, often people say, well, no, that's the problem. I've got these impossible demands placed on me. But actually, sometimes you can change the demands, or if you can't change them in that particular situation, you can change them elsewhere. So you can think, all right, while I'm having this new practice premises built for the next 6 months, I'm going to take myself off this committee and that committee, or I'm going to do less of this at the weekends. I'm going to just do it once a month instead of every weekend, or something like that. So you can reduce the demands elsewhere. You can change your perceptions, and there's a whole range of strategies to do that. You can learn to think more optimistically rather than pessimistically, and I'm not talking about just being happy all the time, but you can learn to compartmentalize your negative thoughts. You can learn to wear different hats to sort of view things in different ways. You can go and pay somebody and see a therapist to help you to recognize unhelpful thinking patterns and retrain and find some more helpful ways of thinking. And for many of us, we can get access to some free sessions of that through our insurance agencies and stuff. So it's worth doing. And the last one is your coping mechanisms or your resources. And for most situations, there is a skill you can learn that might help it. So it might be financial training, mindfulness, assertiveness, communication skills. So I think this is a very useful equation to apply to situations. And this is just a reminder that if you have ongoing high levels of perceived stress, that does lead to physical illness, often with the ongoing cortisol and the effect. Another concept I just wanted to bring up was the idea of thinking of your early warning signs of stress as smoke alarms, as a signal that something is happening. And so when we get triggered by a threat, we often have a response, a stress response, and that can be, and everybody will be aware of this, but it can be a physiological thing or a behavioral or a physical thing. I think a couple of things about early warning signs that are useful is that other people sometimes notice them first. They can be very specific. So if you ask the people you live with, they will love to tell you your early warning signs of stress. They'll probably give you a list. But they can be very specific, like you might stop singing in the shower or something when your depression starts to come back. But I think having an idea of your own early warning signs and the order they tend to come in is probably one of the most useful things we could do. So if we only had 10 minutes to talk together tonight, I would say this would be the thing I would say, would be to identify your early warning signs of stress and link them to an action plan. We tend to do the same things every time, not always, but usually. So it might be that when you first get stressed, you notice that your sleep pattern changes, and then if it carries on for another week or two, your psoriasis starts off and this sort of thing. We often have a similar pattern. So here are some early warning signs of stress. You may recognize them. You may have some that aren't on here. You may have all of these. And that's, it's good to be aware of what they are. I think we're often quite good at being aware of our physical ones. We're often less aware of our behavioral ones, like spending more money or interrupting people more, that sort of stuff. We can be a bit less aware of those. So a useful thing, you can circle your ones, or if you're with anybody who knows you, they can tell you which ones yours are. This is just another slide I want to put in. This is from the Magpie study, but I do like a nice Venn diagram, so I had to put one in somewhere. But this was just a study, a New Zealand study several years ago now, where they interviewed people in GPs' waiting rooms or in practice waiting rooms, and asked them, did a survey really looking at depression, anxiety, and substance use. And this is just anybody who was in there in primary healthcare. They hadn't come in for a particular consultation, and this was the overlap. So this is I think very interesting, just looking at the general overlap of depression, anxiety, and substance use. And often when people are unwell, and that includes ourselves, we have an overlap of these things. And the reason I really wanted to put it in was just to mention substance use. It's very common as a behavioural thing to, often to drink a bit more alcohol, and that's a common thing that clinicians tend to do. And it can sometimes be a form of self-medication. So it's quite a useful thing to think about, although quite a hard thing to think about, I think. Am I drinking alcohol to self-medicate to reduce my anxiety after a difficult day at work, or to change my mood? And so I think sometimes that sort of, I really need a drink time is the time maybe to be finding some other strategies to reduce stress, or to think about whether that's something that you would want to shift. So I suppose the key here is just to see these signs as a message rather than some sort of weakness, because we tend to beat ourselves up about these sorts of things in general. And there's a huge body of evidence around health practitioners not seeking help, delaying and avoiding, struggling on, working harder, doing more, not talking to people, and just avoiding help. Help seeking and putting other people first, actually that can become not helpful for yourself or for those around you, or in fact for your patients, and ultimately can lead to poorer patient care. There was a big study in the BMJ showing that that was a study with doctors, depressed doctors made 6 times more medication errors than doctors who weren't depressed. So that was a few years ago, but really that was quite a critical study when that came out. But of course it makes sense, doesn't it? Anyone, when you're depressed, you're not focusing, you're not concentrating in the same way. So I think it's important to think about for your patients as well as for yourself, of course. So I just wanted to touch on some specific strategies here for people who are interested in this sort of thing. It depends on whether you have extremely stressful moments, depends on your job, doesn't it? But these are just some useful techniques. I'm talking here about a very stressful moment. What do you do in a moment of extreme, almost panic, where you have to really focus, maybe in an arrest, or, something major is happening in front of you, especially for newer practitioners who are just learning to manage a very difficult situation. So I think the key thing is you need to manage your breathing first. So diaphragm breathing. So and I'm being aware, I'm talking to experienced people here, thinking, yeah, we know what diaphragm breathing is, but breathing from your belly, and taking your stomach moves out as you're breathing in, and you shouldn't be moving your shoulders up and down. I used to teach singing, I used to teach a lot of diaphragm breathing, but if you're breathing incorrectly, chest breathing, you'll be heaving your shoulders up and down. If you're breathing from your diaphragm, nice demonstration.
Yeah, it makes me think about it.
If you breathe from your diaphragm, you breathe from here, so I'm doing a diaphragm breath, and your shoulders don't move. So you take a slow breath into your stomach, and you can actually practice this at home until you can get really quite proficient at it. You can feel yourself doing a deep diaphragm breath. I practiced this a lot, mainly for singing, I have to say, but I've used it in stress situations. If you aren't actually sure what you're doing, it's useful to either practice in front of a mirror, so you can watch your shoulders to see if they move up and down, or you can hold onto your ribs to see if they heave up and down, or if they should just move slightly out. People can try this just now because nobody's really looking. So if you take a deep breath in, your ribs should just slightly expand and then out. Whereas if you're taking a chest breath, they'll move up and down, okay? And the other way, almost the easiest way to do it, is to practice lying on the floor. You could even do that if you wanted now. If you're lying on the floor, you generally tend to do a diaphragm breath because your ribs don't like to move up and down. It's the way we breathe when we're sleeping. But the useful thing about a diaphragm breath is that when you do one, your body thinks, actually I'm relaxed, and it switches off your adrenaline, and you can actually calm yourself down, calm your system down very quickly by taking a diaphragm breath. It sort of tricks your body into making your adrenaline switch off, and you can focus again. Because I don't know about you, but I find if I'm in a panicky situation, it's hard to think. So one slow diaphragm breath can really switch that off. Another technique is grounding. For some people, this will be really pushing their hippie edges, and there'll be questions coming in saying, for goodness sake, who is that woman, or what is she on about? But there's a technique by Russ Harris, who's well known for ACT, and it's called the tree exercise. If you Google Russ Harris, the tree exercise, you can find it. And in fact, there's an audio you can listen to. But this is an exercise you practice at home first. It's a visualization where you imagine you're a tree. I didn't bring it to read out. I thought that would be going a bit far. But you sort of imagine yourself, you're standing, you're being strong, you've got your eyes closed, you're practicing this at home, you're feeling yourself firmly in the ground, your feet against the floor, and being strong. And then what you do when you're in a stressful situation and you have put your feet against the floor and you feel strong, and you feel grounded, and it almost feels like you're growing roots into the floor. Sounds a bit odd, but very useful for angry people. If you're of any angry people shouting at you and you stand there and feel that you're growing into the floor, makes you feel quite strong and grounded. But there's different sorts of grounding exercises. You can find a lot of these just by Googling. The third thing I think is useful.
Fiona, we've just had someone.
Oh no, I knew.
Oh no, actually, someone's just written in saying in a consult they've found that they sometimes clench their toes.
Oh, nice.
Whether that's a type of grounding for them, or whether it's just a natural response to an angry patient or a very stressful moment. But yes, I guess that can be, it's being aware of something that you're doing.
Yeah. So that's really, it's a similar thing, really. It doesn't matter what you do. It's a sort of awareness, brings you back to your body. Yes. And out of your head.
Yes.
So yeah, it could be a breath, but it can be a body thing that you do. Yeah. Exactly. Yeah, fantastic. Good. Thank you for sharing that. I was feeling a bit anxious about what they were going to say there.
No, it's good.
So the last bit of that is self-talk, and I don't mean sort of affirmations or anything like that. It's really when you're in a very stressful situation, some of us have very negative, panicky thoughts. Oh God, it's all going wrong. I don't know what to do. Those sorts of thoughts. And what you can do is you can focus instead on positive thoughts. It's all right. You've got this. You've managed this before. You've had some training. And you just tune into your positive thoughts and sort of move your focus away from your negative thoughts. And you can do this pretty successfully. The army do a version of this, but they sort of train their positive thoughts to shout over their more negative, panicky thoughts. A bit of a sort of sergeant major approach to cognitive therapy or something, I don't know what. But anyway, it's this similar thing. You're just tuning into those positive thoughts instead of focusing on the negative, panicky ones, and that can affect. So I think these are the three most useful techniques. I'm sure people out there will have more. And we're happy for you to contribute so we can share them.
Someone has actually asked a little bit earlier about how you compartmentalize within a stressful situation or with stress in general. And now, is that something you want to have a chat about now, or something?
So in a stressful situation, I think that in order to compartmentalize, you would need to distance yourself from it insofar as you can. And really what we're talking about here is mindfulness, which I'm not going to spend the whole evening going on about mindfulness, but I know it's one of those words that people can have a bit of a reaction to, or people have different views about. And but basically, mindfulness is a state of mind where you're choosing to put your attention in the present moment. You're choosing where you put your attention. And mindfulness meditation, and this is just one way of describing it, but mindfulness meditation is the practice that you can do in order to get better, I suppose, at more focused at choosing instantly where you put your attention. And then you can do that in a day-to-day moment. So if you had done training in mindfulness and you were good at choosing where to put your attention, and you were able to do that in a moment of stress, you can be aware of some of the other things, but you can think, I'm going to focus, I'm choosing to put my attention on the airway or whatever, and you just let the other thoughts sort of go past you, a bit like a wave. You just put your focus in one place. So instead of jumping on all the other thoughts and getting distracted, so they talk about mindfulness is like with a train of thoughts, but with mindfulness you stay on the platform rather than jumping on the train of thoughts and zipping around. So you're aware of things, but you still can choose. And you, I mean, and getting into mindfulness is sort of beyond this talk, but the evidence used to be, you know, there's a lot of evidence around 8-week mindfulness-based stress reduction courses or mindfulness-based cognitive therapy. And I've done those courses, and there's lots of them available around the country. It's about 2.5 hours a week you do, and home exercises. But in fact, there's evidence that you can do much shorter mindfulness practice, and it can have quite a big effect. So some of the apps that you can use to do that, like with Headspace and, you know, some of these sorts of things, you can train yourself relatively quickly to, you know, to be able to choose where to put your attention when something happens. And that's really useful.
So you can see that happening within a moment, so a very stressful time, say an angry patient or something like that. But equally, you can do that if you're having a particularly stressful time over a period, choosing to be mindful around when you are not at work, when you are at home, and being able to be more calm or comfortable or happy in those situations, and not necessarily bringing that stress into
That's a really good point, because what Helen's saying there is really referring to lots of our tendency to fill up our mind with either ruminating, which is thinking about past negative things that we go over and over, or worrying, which is anticipating future negative things that might or might not happen, but we spend a lot of time doing that. And if you're ruminating or worrying, your body still is having a stress response and you still are feeling pretty miserable. Whereas you can actually become aware, I'm ruminating or I'm worrying, and then you can choose to switch your focus elsewhere. So I used to do a lot of, when I was walking to work, I used to do a lot of ruminating, and I now have a ruminating stamp that I imagine comes down like an old library stamp across my thoughts. It's red, and then I think, oh, ruminating, yep, and then I switch my thoughts back to, oh, the sun feels nice, or that blossom looks nice on that tree, and that sort of thing. So it can be quite a useful thing, and it can be quite easily learned, I think, and quite fast that you can learn to do these sorts of things if you like.
Thank you.
Okay, so I've got a few strategies here. I've just underlined psychological. We've just spoken about a couple of ones there, and there are obviously many things that that I could have put on here, but we've spoken a little bit about diaphragm breathing, progressive muscle relaxation, and sometimes the clenching toe thing is almost a bit of that, where you squeeze a certain muscle in your body and then relax. You can practice doing these things at home. I think that makes a difference. Recognizing your early warning signs. A lot of stuff about acceptance for people who are interested in that ACT is the thing to look up. Increasingly, I think there's going to be more evidence in that area. If there's a major thing that's going on in your life, one of the things I learned on a course that I found very interesting was about acceptance. And it doesn't mean you're saying it's okay, but they had an equation. I just sound like I'm obsessed with equations and diagrams and things here, but their equation was suffering is equal to pain times resistance. Suffering is equal to pain times resistance. So suffering, the amount of suffering you undergo, is equal to the pain, that's the bad thing that's happening, or the painful thing that's happening, times your resistance. Because the thing is already happening and you're already being affected by it, and if you add your resistance of that to it, it can amplify your suffering. So that sort of changed my view a bit about acceptance, because that made sense to me. I could really see that. So I think accepting, okay, given that this is the situation, let's look at what I can do to help. What are the things that are the options? Is there any problem solving? Is there any support I can get?
It's not resignation.
No, it's not saying, it might be completely unfair, the thing that's happening, completely ridiculous or unfair. And but if you are in that situation, I think accepting that that's the effect it's having on you. A lot of people can put a lot of energy into that resistance, and it can amplify things and probably stop them being able to problem solve and move on. So I think that's a useful thing to consider. Counselling and psychotherapy, I mean, I think it's so useful to go and pay somebody to write on a whiteboard, somebody with no agenda, somebody to teach you some skills. I've certainly done it a few times myself. I'll do it in the future. It's so handy, I think, to have an outside view by a skilled professional to get some new techniques on board. Gratitude diaries, a lot of evidence for them, or some evidence for them. Gratitude diary, you just write down, there's different ways you can do it. You can write down 3 things at the end of every day that you're grateful for. And then you just keep your diary. It's really nice to have. You can get gratitude apps now. You can do it on your phone when you can take a picture of a sunset. And one of the studies I read about it just looked at people who kept a gratitude diary for a week compared to people who hadn't, and they followed them up 6 months later and found that the people who'd kept the diary had less symptoms of depression 6 months later because it trains you to start looking out for positive things and noticing them when they happen. So that's useful. We've got some stuff about gratitude on the CALM website. Tony Fernando talks about that. That's the CALM website, CALM. It's my accent. I don't say it in a New Zealandish way.
Calm.
That's great. And forgiveness, there's some evidence around that. There was a big forgiveness RCT where they looked at people who'd had something happen they were holding on to and did some forgiveness therapy with them and helped people to try to move on from that in terms of their happiness and well-being scores. It had an impact. And self-compassion, which I'm going to come to later, but I think that's key in health professionals and increasingly shown in the evidence. People with low self-compassion scores are often linked to higher depression, anxiety, and burnout. Okay. This is my favourite. This is a book, but Anne Williamson's now got a website, and she's put most of the stuff in this book on the website. It's a very small book. You can buy it. I've never had a copy because I give them away, but it only takes about an hour or two to read. And it is full of lots and lots of little techniques for managing worried thinking. I have, got students to look it up online 2 days before an exam, and they've managed to learn something to help them. So it's a really useful thing to have. Anne Williamson's a primary care practitioner in London. She's just retired actually recently, but she worked in as a GP for years and years. She's also written another excellent book called Brief Interventions. It'll be on our website. I think it's called Brief Interventions in Practice, where she applied lots and lots of these techniques, in her day-to-day work as a GP in Britain in 10-minute consultations. And she's got some case studies of how she did that. So I find her quite an inspiring woman.
Now, just before we go to burnout, we've got a couple of questions.
Okay, come back.
First one here is, how do you identify when it is strategies that you need to how do you identify when the strategies you need to implement to cope with the stress, or whether it's the environment, e.g. staffing, management, workplace culture, that needs to change? So I guess the stress or the strategies, the coping versus the environment that needs to change.
Well, I think it's hard to tease it apart. Usually systems factors are part of the problem. So very often there's systems factors and individual factors that work together. So one of the things I've got later in this talk is a one big diagram that has all these things, systems factors and individual factors, so that you can look at them. Very often these things go hand in hand, that there's systems factors happening. So if you take an example of, say, bullying, I'm doing a lot of work at the moment in bullying in the hospital environment. Very often there have often been a lot of systems factors that are happening at the same time as an individual is behaving in an unprofessional manner, and the two things are happening in tandem. So I think there's been a tendency in the past sometimes for people to say, oh, it's, anybody when they're stressed, oh, that person needs to be more resilient, and and I have a problem with that. I think, yes, we need a certain level of resilience as health professionals to be able to do our job, but we're very often working in systems that are dysfunctional and adding to the problem. So I suspect it will be both. It's easier to look for both, and it also acknowledges that there probably are both individual things that can be done. The burnout prevention programs that have been done, interventions that involve systems and individuals, are much more successful.
So addressing both from the start.
Yeah.
Fantastic. There's one more comment here that resistance might reduce the chances of the pain being inflicted later on themselves or others. What do you think about that?
Goodness.
Yeah.
It might reduce, just let me think that through.
So resistance might reduce the chances of the pain being inflicted later on self or others. So it's trying to actively, I guess, increase your resilience against that pain, possibly.
I think so. I mean, it's an interesting thing, isn't it? Does pain make you stronger? Yes, to some level. It's all about well, I suppose we're all different with the way we manage things. So for some people, they go through a very stressful situation and they come out of it a bit stronger, whereas for other people, it's just too much. I think you need to look at it in the context of an individual's stress vulnerability model and where their particular resilience threshold is at that particular time, would be what I would say about that. Okay.
Okay, and now here, the very last one here before we move on to burnout. How can we deal with the stress of dealing with staff who have difficult behaviour, staff that you are not able to avoid in your day-to-day work? And I think you touched on that just a bit earlier, and you're probably going to carry on to talk a little bit more about that.
Yes, I mean, with we're not sort of doing communication things tonight, but it's a major cause of stress in primary care in all sorts of clinical settings. I think there are a variety of things, so it's quite good to be able to, not in the heat of the situation, outside of the situation, to try to break down what's happening and to now I really am going to sound obsessed here, but this is the sort of thing that is very useful with this type of Venn diagram where you have a staff member and another staff member and the environment. So if you can draw it out, or 3 staff members or however many it is, and you say what are the overlapping factors here in these people's relationship, the dynamic or the power dynamic or whatever in the middle of the diagram, and what are the factors in this person, and that might be personality or previous experience, and then what are the factors in this person, and what are the systems factors, we are underfunded, or there's a pneumatic drill outside the window, or and then you that helps you to step back from it a bit rather than just saying it's all this person's fault. It might be 90% that person's personality, but it's not necessarily always that. So it's useful to do that first. That's one exercise you can do to get that perspective first. You can also do a fly on the wall exercise where you break something down after a difficult interaction and you write about it. It's a reflective writing thing you can do. Write about it from one person's point of view, write about it from the other person's point of view, write about it from a fly on the wall point of view of what was happening verbally and non-verbally during that interaction. How were people moving and leaning and looking? That can give you a bit of insight. So let's say you've done all of that and you've identified, yep, it's 90% this person's interactions. Then I think you're looking at retraining, communication skills training, or a mixture of communication skills and supervision. Often at Connect these days, when we're working with clinicians, we do a bit of one-on-one supervision first, and then we'll move and help the person to identify what the issues are for them and why they might interact in a certain way under pressure, or certain situations will trigger them. I mean, all of us have certain situations that trigger us, and they can try to identify why that is. I'm not talking about long-term therapy here. I'm just talking about behavioural patterns and triggers for that. And then we would work with actors and practice those particular situations and record the person, get them to watch themselves. So that's retraining. And then through that, somebody develops some awareness, usually, of what they're able to change. My experience is for people who have no insight at all, or very, very little insight, which I have to say is a lot rarer than people say, because I think often once you listen to someone and get them on board and find out what's going on, they do have a reasonable amount of insight. But in the rare occasions that somebody has very little insight, really linking their behaviour to consequences is probably the most useful thing to be doing. If this behaviour carries on, this is the likely consequence. And in order for this not to be the consequence, this is how the behaviour would need to change. It's my view on that.
Well, let's carry on to burnout.
Okay.
There's a few questions already about burnout, and then we'll come back to some of these.
How are we doing for time?
We're all good. 8:06, so we're good.
All right. Now, look, I've got a story for this point of the evening, because otherwise it's too dry. So this story is a story about burnout for people to listen to, so you don't need to look at any slides. The idea of this story is that it contains signs and symptoms and consequences of burnout. So it might be a bit depressing to listen to, but then we'll break it down afterwards. So it does give you a chance to be a bit less academic while you're listening and just see what you can hear in the story. Okay, so I've got my reading glasses on. Here we go. Surrounded by the womb-like familiarity of exhaustion, he focuses on the job, the muffled sounds of the outside world, a daily backdrop to ignore. Dragging his flickering attention back to the task at hand, he grinds out another day's work, dutiful, resentful, and defeated. He's unaware that apathy has narrowed his view and affected those around him who've given up suggesting anything new. Opportunities and risks drift by unnoticed. His problem-solving ability has become dulled by the routine. Enthusiasm, self-respect, and creativity are words from his past. Well, if you feel as if you're stuck inside a box, why bother thinking outside it? He only sees what's in front of him. He only does what's required of him. Limiting, unfulfilled, and dangerous. There's no point in him saying anything as nobody listens, and he stopped listening years ago to other people and to the part of himself that made him good at his job. Even though you're here, you're not really here. His wife's frustration at his lack of presence boils over into an argument as his weariness and disconnection seep into his home life. On some reason, he realizes that something's wrong as he limps from holiday to holiday, when he briefly re-emerges and they both catch a glimpse of his old self. But on another level, the daily grind has become a safe haven from change or conflict, which have always terrified him. Weeks turn into years. If somebody had asked him, "But what will you leave behind? What do you want to achieve with your life and your work?" he would only have glanced at them dully with unseeing eyes before returning to the job. So that story, just to let you know, is not a real story from a person. It's just a created story to illustrate all the signs and symptoms and consequences, or most of them, of burnout. So it's, I'm aware, pretty extreme, but it can be useful to think for yourself or for colleagues if there are any particular parts which resonate. Sometimes a story can resonate in a way that intellectual concept can't. Which is really, I suppose, why I brought in a story as an educational way of thinking about things. So the signs and symptoms we're going to go through, and there's quite a few consequences in that story. And I think, often we think about the consequences for the person, but all this sort of being very shut down, the risks and the missing opportunities, missing chances, not noticing things around you, and the way that the others around you at work and at home are affected. And I suppose I feel very passionate about this because these things are fixable problems. I think it's important to differentiate between burnout and depression, and that can be difficult because there's some overlap. You could have both. One key difference is burnout, and we're going to go through what it is exactly, but it does have a systems factors involved in it. So if you are burnt out and you go away on holiday, it's possible that your symptoms completely disappear and you feel fine. And then when you come back to work, especially into a dysfunctional, overloaded system, your symptoms can reappear. And that's usually burnout, whereas depression, doesn't necessarily disappear when you're on holiday. But they can, depression can make burnout more likely. But I think it's a good idea to see your GP or nurse practitioner or whoever to make sure that you get a proper assessment if you think you might have one or other or both, because they have different management. So I thought I might go through some of the things of burnout here. Just a quote to start off with. I like this quote just because it reminds us of, no matter how resilient we are, that if you're in a dysfunctional system, there's, it's not your fault. So burnout is a concept. It's got three central components: emotional exhaustion, the stress, what's called the stress dimension; cynicism, this is the way that we respond to others; and then the last one's a sort of self-evaluation dimension of feeling more inefficient. Okay, so there's the three dimensions of it: emotional exhaustion and overload. The key symptom of burnout really is physical and or emotional exhaustion. It's it's if you're not exhausted, you're probably not burnt out. Cynicism is the way you're detached, you're depersonalized, you treat people like they're not people. There's a chest pain in room 2. I've been working with dentists recently. They say there's a toothache in the waiting room and similar stuff. And we all do that. Sometimes it's when that language becomes a normal way of being. Black humor, cynical, cold, detached. not connected to people or yourself, is that arm of burnout. And then the last bit's being inefficient, not feeling very effective, not feeling very efficient. And there's one thought of burnout prevention and management is all you need to do is identify which of these three spectrums tend to kick off for you. Yep, it's the exhaustion one, or the detached one, or the, or all of them. And then think, what can I do to slide things up the other end of the scale? I am exhausted. What can I do to have more energy? Okay, and there's a whole range of things in that, could be physical things or different for different people. I am disconnected and remote. What can I do to be more connected to people? That's a bit harder, but I met a clinician who realized that this was his tendency when he started to become burnt out. And what he does now is, he's working in a hospital, is he goes around the hospital once a week and finds a patient who's not his patient. And he talks to them about how they are, what brought them in, and how they've been getting on. And he finds when he's listening to them as a person and he's not listening for symptoms, he's not listening to fix, it reconnects him to people and he's much better with his patients. And that has stopped him from
That's a lovely idea. Yeah.
But whereas other people say, my God, I don't want to see an extra patient, so the last thing I want to do. But that worked for him. But that's a really good example of somebody being aware of his own tendency and having an action that you link to it. Yeah. And then the last strand of burnout is this being ineffective, inefficient. And you can think, when have I been more efficient in the past? What do I need to do? What do I know that works for me in terms of being more effective? So the two main causes are the demands, and people tend to know this, overload, demands. But the other one is conflict, and I think people know that less. So conflict's a big driver of burnout. And I'm talking about external conflict in an ongoing way, or can be internal conflict. You're going to work thinking, oh, I wish I had done art history, or, that sort of thing. That's internal conflict. Or you're working in a place that doesn't sit with your values, and I've just put values up on the side, or where you feel things are very unfair. That sort of drives burnout. Other things that are in that mix are how much control or autonomy you have, whether you're using your skills. If you are highly skilled in an area or have a skill that you love using and you're not using it in your current job, that can be a risk factor. Doesn't mean you will burn out, it just adds into the mix. And we've got a big rectangle around this to show that this is within a system. So these are an effect on an individual within a system. Lots of consequences: personal, physical, and emotional health. Professional attrition from the workforce, and patient consequences, and some of the stuff I've alluded to. This is an official definition for people who like those sorts of things. But I think it's useful to remember that it is individual and systems are both mixed up in that. It's not on a spectrum from depression or stress. It's a different sort of concept. People sometimes write about it like that. I don't see it like that. If it's on a spectrum, the opposite to burnout is what's called engagement, I think, which I'm going to show you. So this is the Mayo Clinic's diagram, and it's really fantastic from a new article they've got out. And it looks at the three parts of burnout and the opposite, which is being invigorated. That's being invigorated, dedicated and absorbed. And it has these 7 dimensions. And this is a fantastic article, I think. But it gets you to think about which of these is the biggest driver for you, which of the one that you think's missing, or the one that might be driving your burnout, or the one that makes you feel more engaged. And the Mayo Clinic's take on it is that for all of us, the most useful thing to do is to identify the most important driver for you, and then to try to work with that. Okay, and they have really excellent sort of a table with different parts that you can look at for that. It's a very good article, actually. So I've got some symptoms and signs of burnout here. We had lots of these in the story. I just wanted to list them, but I don't want to go back through them. So these are some of the symptoms and signs. There's some more there. There's some team ones at the bottom there. So I've already spoken about those there. You can see the physical stuff's up there and the behavioural stuff. Okay, this is a good picture. It's my favourite burnout picture.
I love it.
So if you want to get, if you want to read more about, find an article that's useful. If you Google being connected, the key to my survival, you'll get to this PDF. And it has that list of symptoms and signs of burnout. And it also has, which I'm just about to put up, some things you can do about it, a big list of things you can do, plus a fantastic list of things that clinicians have done in their day-to-day life, where they've incorporated little things into their day to prevent or manage burnout. And that might be little mindfulness exercises like being really aware of the water on your hands if you wash your hands in between patients, but it's got a whole list of stuff in there. So I think this is a really, really useful article. Yeah, if you want to look that up. I just was reading about this the other day, but this is the 3 key factors that were cited really as being the most important things for helping someone flourish. And flourish is on the opposite end of the spectrum there, isn't it? But choice, it's there again, and connectedness is key. And I think opportunities for excellence is a useful concept, because sometimes I think it can be quite hard to find that. And you sort of do the same thing and you're doing more of the same thing. And thinking about, where do I have the opportunity to be excellent? You know, it might be taking the aspect of your practice that you like best. Even if you're feeling tired, you can think, oh, there still is a thing that you like in there that you like best. And can you do more of that? Is there an opportunity for doing more of that? And that can make a massive difference to your work life, actually. So this is from that same article. So these are some of the things we've spoken about: mindfulness, connection, supervision is really important. Often people say, I've got a peer group, and a peer group can be a supportive place, but it can actually just be an educational place, and that's great, but it doesn't mean that it's a place where you would say, I'm feeling overloaded, I don't like my job, you know, I wish I'd done something else. You know, then it's good to recognize, actually, it's not a place, I'm having this terrible conflict at work all the time and I can't talk to anyone about it. And to then get a supervisor. You know, I think it's really important to have a supervisor, and, you know, go once a month. Lots of doctors have a supervisor, lots of nurses have a supervisor, and you can go along and just talk with them about the stuff that's happening. Choice is there again. What else have we got? Communication skills. I didn't write this list, I promise you. Self-care activities is about sort of putting your stuff first. I'm not great at this myself, I have to say, but I think a useful practice is having a sort of bottom line. What do I absolutely have to make sure I always do? And then what are the added extras? And I think that can be helpful. Meaning-centered intervention for the team. Imagine if you had that discussion around what would be something that we could all do that would make our life feel more meaningful. We ask the medical students now, what gives you meaning in life, and they roll their eyes, but they have to write about that. Interesting to actually stop and reflect on. I've got some more strategies I wanted to put in here, my section. So some people say all you need to do is an endorphin producing activity for half an hour a day and you will always be fine. So that is exercise, which we all know about. Laughter, and here the evidence is talking about laughing as in ha 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 laughing, not just smiling vaguely. People do go to laughter yoga.
Yes, of course.
I did it once. We had it at Goodfellow conference, in fact, and we did laughter yoga in the morning ages ago, and it was interesting. I did laugh all the way through, partly because I was feeling embarrassed, I think, but even so, I still laughed, and it was good fun. So I think they have some of these courses around meditation is your other thing. So a big body of evidence around meditation producing endorphins. This is a really fantastic resource. So for people who are interested in this topic, especially if you're wanting to look at it for your workplace, this is the best site. So the National Academy of Medicine in the States has got a 4-year project going. It's just over halfway through, and they have collected all the world experts on clinician well-being, and this is for multiple different sorts of health professionals, and they have collected all the evidence and they put it on their articles. For people who are doing research, there's instruments, but also they've got this big model of all the factors that are involved and what can you do, what are the interventions that work, and they're going to be carrying on adding to this for the next 2 years. So it's really brilliant, and this will get you, anybody can go onto that website. And this is their conceptual model of well-being. So I put it all here, which is like on one slide, but I really like this model because it has individual factors, and I was referring to earlier, and external factors. And interestingly, they have more on the external side. But I've worked with this model. This hasn't been out for long, but I've used it in some workshops where if you take this model, if you take this to a group of people who work in the same place and you ask them to highlight what are the areas that you think are affecting well-being in your workplace, they'll very often be highlighting the same things on the external factors, and they'll identify systems factors, and then it gives you a very clear thing that you need to work on and problem solve. Okay, how can we improve this? How can we change this particular area? Rather than it just being a big generic, the system's not working or work's too stressful, it really helps you break it down. So I think this is fantastic, and I think they're meant to carry on updating this site so that it all becomes interactive and you can click on all these different bits and it gives you more information. So yeah, that's probably the most useful thing. And what else have we spoken about? I'm not going to go into physical health, but we've done a bit about psychological health. Connection is really important, and I think a lot of practitioners aren't particularly well connected, sadly. We have our peer groups and they can be supportive, but connection to yourself, connection to having fun, asking yourself what you do for fun and can you do more of that. And supervision, I don't think many of us have supervision, so I think that's a useful thing to think about. It's got a nice supportive structure there. And we've spoken about meaning in life, so asking yourself what gives you meaning, purpose and value, MPV, what fills your spirit. So for some people, spirituality is a religious thing. For other people it's not, but whatever gives you meaning, purpose and value in your life. And if you aren't sure of the answer to that, then that's a really useful thing to reflect on, because if you just tend to live in your daily grind, the evidence is that you will tend to become more unwell. So perfectionism. I've been reading a lot about this in health practitioners. It does seem to be linked to quite a lot of psychological ill health. People say, well, what's wrong with being a perfectionist? And certainly it has we select perfectionists for medical school, I'm sure. So, people finish things off, they look at things thoroughly. But I think there's a difference between striving for excellence and perfectionism. So somebody who strives for excellence will get 98% and, be happy with that. Somebody who is very perfectionistic mindset will be obsessive about the 2% they don't get and ruminate on that. Also, the outcome in health is not always in our control, so you can have a brilliant training, brilliant intention, do your very, very best job, but the outcome does not always go exactly the way that you anticipate or that you want it to. So acknowledging that, gets you a bit out of the perfectionist mindset, and it can be really, really useful. Sort of letting go of perfectionism can be one of the most useful things for some people to do, and replacing it with striving for excellence. Because there's a cycle, and some people listening to this won't know what I'm talking about, but other people will recognize themselves or others, or in fact their partners in it, work partners or home partners, that you can get into a bit of a self-driven perfectionist, then it's never going to be good enough, anxious, and then self-criticism. So people drive themselves with self-criticism, very negative way of driving yourself, and you can learn to drive yourself with positive thoughts instead of negative ones, and that's a skill you can learn. So that's just there. And if you're wanting to work on that, self-compassion is the way to go. And this website, Kristen Neff's website, www.selfcompassion.org, has got 8 different ways you can learn self-compassion, and it helps you to learn to be less critical and to be more accepting of the fact that you're a human, and to notice when you're driving yourself with criticism, and to learn to, they talk about, support yourself with kindness. So you can do a mindful self-compassion course. I've done one of those as well. They're also 8-week courses. But I think it's worth thinking about if that's the way you've always driven yourself. Okay, so day-to-day stuff. I've told you about that article, which I think is good. I've mentioned the bottom line thing. So bottom line, self-care is very useful for people who have a bit of an all or nothing mindset. So that's me. I have an all or nothing. I had an all or nothing mindset. I'm working on it. I'm better than I was. But so, for instance, a good example from my all or nothing mindset would be exercise. Setting up some gym program that's 2 lots of cardio and 2 lots of weights and whatever. Then finding that I can't get there, and then abandoning the whole thing, doing nothing for a couple of weeks, and then trying to pick it up again. So I stopped that several years ago, actually, and I decided I'd have a bottom line. If I can't do my ideal, what's my bottom line? Okay, going for a run for 3 times a week just from the house, which will take me half an hour. So I sort of have something else I drop to instead of beating myself up about not managing to do that one, and that has been really, really useful. Perfectionists we've spoken on, and thinking about systems factors. I think some of these little systems factors things can cause a huge amount of stress in a team, and they do it every day, all day. It's the same thing. So an example of that would be when I was working in London. Once there was ongoing arguments with the repeat prescription system, where patients would come in, they'd be arguing with the receptionist. Yes, it's meant to be ready. The receptionist would get stressed. They would be saying to the doctors, why haven't you done this yet? And we did a really simple audit where we stamped the times of when the prescriptions were put in, of when they were filed in the doctor's baskets, of when the prescriptions were written, of when they were back out for patients, and in fact found that in 98% of the time it was the patients saying that they'd left it for 24 hours when they hadn't.
Right. Yeah.
But there had been such a lot of ongoing arguments about it. So after that, we just had a timestamp, and we stamped them with the date and time when they came in front of the patient, and it all just stopped. So that is a really simple thing, but that's an example of some of these little systems factors that can cause a lot of day-to-day stress, and then you get major emergencies on top of it. But actually, there can be quite fixable things when you identify them. These are just some resources, the CALM website. I like the Black Dog Institute. It's always up to date. It has great sort of one-page things on anxiety or whatever it is you want. It always has a current, very useful for our patients and for ourselves. Martin Seligman's positive psychology sort of site, you can see how happy you are compared to other people your age, and if you like to do that sort of stuff. But also in his book, Learned Optimism can help you to train yourself to think more optimistically rather than pessimistically. And that's not just being happy, it's just noticing when you're spreading negative things. Mental Health Foundation often has lots of good news stuff on there. It had a resilience workbook up there for a while. Sparks is fantastic. If you haven't used it, it's just the best thing. It's still free in New Zealand. Website really for young people, but it's learning resilience skills through video games. Massive study done on it, front cover of the BMJ when it came out. Loads of countries are after it, but we can still use it for free, and you just play games and it teaches resiliency skills through that. Big White Wall is a fantastic UK site where you can write your thoughts on, and they go up on the brick on the wall. It's all very graffiti orientated. I'm not sure if they still do, but they had tokens you could buy to talk to a therapist. They have great sort of bank of therapists, so you could do that at home online after hours, because it's a UK site. So I knew a lot of people who were doing that in the evening here. Anne Williamson, I've mentioned. Some apps there. Insight Timer is a great meditation app. You can scan through it. It'll give you something for 5 minutes or 10 minutes, or it will tell you what sort of thing is nice for the morning, upbeat, good for going to sleep, that sort of thing. So it's very handy. Also, it'll tell you so many people in the world are meditating, if you want to do all that. And of course, Beyond Blue is brilliant. I just wanted to let you know before I go, for people who don't, but I have a part-time job with Connect. I have a part-time job at the university, at the medical school. One of the directors of student affairs, and we've created this health and wellbeing curriculum for medical students called Safe Doctors that has now been in the curriculum since 2013. It is in every year of the programme. It is assessed. Students have to pass it. They learn all these topics. They learn about them again and again and again all the way through. It's certainly, we didn't have anything like that.
No.
When I was at medical school.
What a fantastic thing to bring in.
So I'm hoping that the practitioners of the future will have these skills behind them, and we put doctor as patient and colleague there so that they can recognise and support each other. Right.
Yes.
Look at that, 8:30.
Look, you've been fantastic, Fiona. There are a number of questions that have come in, and obviously there's so many different topics that you've touched on, and places that we could go off to with it. So we'll run through some of the questions that have come through first. The first one that came back in a little while ago was, what about making use of a mood scale to determine our level of stress and anxiety?
That's a good idea.
Yeah.
I think that's a good idea. I think scales are a great sort of way of just forcing yourself to be accurate about it. You don't need to come up with any words.
Yeah.
So I think that's a great idea. You could put it on your door and slide it up and down and let your colleagues know
where you're at the time
today,
or your patients.
But another thing you can do with scales, and it's thinking about really from motivational interviewing, where you're saying, where are you at today out of 10? And if it's like, okay, if it's 4, and and so that's a low mood, what could I do to slide from a 4 to a 6? So I think as well as identifying where you are, it's useful to then ask yourself the question of what it takes to move up the scale. And you can even make yourself lists of things to have that help move you up the scale that you keep somewhere to refer to, because at the time you're at a 4, it's hard to remember them. So you could build up from your gratitude diary. There you are, from your gratitude diary. We're developing an intervention together online, but as we speak. But you could then look at lists of ideas you have that might help. Yeah.
Fantastic. Now, what about tears in difficult situations? How can one manage them, and what could they mean? So I'm presuming they're the tears of someone else versus
but it's hard
your
to know,
own
isn't it?
tears.
I mean, Bruce Arrow, who he will ask patients, and in fact he teaches the students to say, if your tears were words, what would they be saying? And I think that is also, I have never actually asked that to a patient, but Bruce certainly does. And I think you can ask it of yourself if you're talking about your own tears. With patients, if patients are crying, I think, which of course happens, often. I think it's about being comfortable with people's tears, letting them cry, not sort of shoving tissues at people to stop them crying, and then it's about reflective listening. So all those sort of core skills that we've got, but saying, oh my goodness, this is really distressing, and trying to get them to tell you, and then to manage that so that you can contain it in your time that you have in primary care. So I think many of us are trying to, depending on your day, and speaking from my own past experience, sometimes feeling like trying to shut people up and move them on sometimes can be counterproductive, because people turn the volume up if you're trying to shut them down. So when somebody's upset, the most important thing really, I really believe, and I think it's better for the time as well, is to turn towards them, to acknowledge their level of distress with words at the appropriate level, and then to that sort of mops up a bit of the emotion, and then you can help problem solve with them. And you may need to state some boundaries around what your role is or not, and what you're able to do or not at that time. But I do believe that it makes a big difference connecting with somebody in a genuine way. Obviously, any reflecting like that needs to be a genuine connection, not just a technique, which of course everyone will be aware of.
They're coming in quickly. How do we create an environment where colleagues can be open, honest, and share our vulnerabilities?
What a fantastic question. I think safety is the key to that. So you would, I think, need to have a forum where you were able to talk without confidentially, with some rules around it, so that you can talk about things where people then aren't going to talk about them to other people, or where people aren't going to use it to score points about things. So I think you can certainly have, we have sort of reflective groups with the students where they bring up something that's been difficult, but we have some quite strict rules around it, about not talking about it afterwards. And I think you need to decide whether it's what sort of discussion it is, whether it's a venting and problem solving sort of discussion, or whether it's just a venting discussion, or whether it's I think, and I've read various things about this. So I think you need to be careful of getting into a very negative complaining thing, where the whole culture is that everybody's sitting talking about negative things. And yes, there's a place for venting, but it's quite good to also be able to think, what can we do? Or let's be aware, look, we're all venting about this. What can we, this is clearly an issue in our system. What can we do about it? There's quite a big body of evidence looking at what's called wishful thinking, which is sort of passive. I wish things were different. I wish it wasn't like this. People who operate like that all the time, and how over time they will become more unwell than somebody who has active coping. So it's not a personality, it's a coping skill. So I think you can become aware that it's a lot of passive stuff, a lot of complaining, and then thinking, okay, that's what we're doing, but let's see if we can switch to active problem solving. Are there demands we can change? Are there perceptions we can change? Are there coping mechanisms? Yeah.
And as you mentioned, some of those peer review groups, where some of them can be incredibly supportive places to discuss things, if they're not necessarily with the colleagues that you want to talk at your workplace.
And some people set up pair informal supervision. So rather than going to supervisor, they might go for a walk with a colleague, and the purpose of the walk is that they're going to talk about stuff at work, and they're going to take a turn each, or and then they're not going to bring it back to anywhere else. So that's a bit more informal, but that can be really helpful for people in a supportive way.
And get your endorphins at the same time. Okay, so the feeling of being unsupported and that then progressing on to possible burnout. And someone has asked, how could we address that, or how could someone address that? And I guess there are lots of techniques you've talked about that tonight that you could use to address that. Or is there anything in particular associated with that unsupported feeling?
Well, I think it is useful. There's different parts to an unsupported feeling, isn't there? So there's one person, two people in the same situation, one of them would feel okay with the support and somebody else wouldn't. So some of it's around the person who is in that situation, whether they, all of us need more support or more challenge at different times in our life. So sometimes you need more support. So I think acknowledging your own factors in it, and then also acknowledging what support is needed. So I think it's useful that's the sort of thing that I would break down with somebody else, or I would pay and go and see somebody for one session and say, right, I need some, or I would get a friend and a big bit of paper, say, I'm feeling unsupported. Some of that might be me, but some of it might not be. What are the other things here? What is it I want support with? Right, I want more support with clinical emergencies, or I want someone to debrief with, or actually break it down. So I would spend some time breaking that down and sorting out exactly what that support might look like. What would I be like if I was feeling supported? Try and imagine that. What would it feel like? What would my work day be like? How would I feel when I got home? And then try to actually visualize what that ideal support would look like, and then how can you get from where you are to there. So I think it's quite a problem-solving thing. That's an ideal thing for a session with a supervisor. It's exactly the sort of thing somebody would do in a session with a supervisor.
There's been a couple of comments that have come in. A patient told me about the website www.moodscope.com, which this particular person has found useful. So back on that mood process. And someone else has written, in salt water is good for you in many ways. Tears, sweat, the seaside, and ivy saline if you need it. So there you go, some tips from you all. The next question is actually there's been a few questions around this. How do you find a good supervisor, and what kind of qualities or relationships should you really be striving for in a supervisor?
So I think you need a supervisor where ideally you don't have a dual relationship with them. If you're having proper supervision, not if you're having informal collegial sort of chats, that's one thing. If you're going to go for supervision, then it's ideal to do it with someone who is not your manager in your practice, or that sort of stuff, because it becomes very muddy, and also you only disclose some stuff, and you're aware they have two hats, and it just is a lot of unnecessary confusion. So there are supervisors, to start naming people, but there are I know doctors who work as supervisors who are trained as doctors and also are then trained as therapists and have done work with supervision, and they supervise health practitioners. So if people want, you can contact me through Connect if you want, and I can send people named supervisor if you want.
Because I think there might be some people needing someone through.
But I think it's and the other, you can do group supervision things. Sometimes people set up a group where they ask a supervisor to come in and do that. And the other thing people join sometimes is a Ballant group, or some people say a Ballant group, which is a bit of a different process. It's not a problem-solving process. It's more of a reflective process where you break down something that happened, and one person will talk about that and the rest of the group will give input, and it's quite a structured format. So that's a very different sort of way of reflecting on things that have happened, as opposed to one-on-one talking or group talking, problem-solving stuff. There's lots of options out there.
And we can contact you through, I think your website is
yes
on the next slide, isn't it?
So we've got if you go to the website, we've got an info@Connect, and you can just email me or Renska, and we can help with hopefully.
There is another question that has come in, which is about someone who's talking about how many patients they feel they could be seeing as a full-time GP, an 18th GP, the number of patients that may contribute to them burning out versus the number that wouldn't, and is there a maximum, or is there a certain level? This particular person has inquired to the GP college about where they should be pitching their level of patients within an 18th role, and didn't really get an adequate answer, and I guess asking in the setting because that's associated with the burnout and stress management?
I mean, I think it's a really useful question, isn't it? Because it's nice to have a benchmark. It would be really, I mean, I can feel my perfectionist side kicking in here, where I want to know what the right answer is. I've got an anti-perfectionist ring I wear. It's a bashed up ring that's made by a jeweler to remind you that life's not perfect. So I'm just declaring that there. Either that or it was just good marketing. But I think the idea of, well, am I feeling stressed, because I'm seeing too many people, or I'm seeing more people than else? The reason they won't give you a number is because some people will be able to see lots of people and not be stressed or burnt out by that. And that's to do with the sort of practice they have, the sort of consultations that they have, the sort of patients that they attract. And this really is like one of those things where you look at the patient factors, you look at the clinician factors, you look at the practice factors of where, how do you advertise, what sort of people go to you, when I was working as a GP, I had a lot of depressed people who used to come and see me all the time, because that was my interest. But as people will know, that's hard to manage in those time frames, and sometimes I would feel irritated that the person next door in my head was just looking at people's ears, and so I think that your area of expertise and interest affects it. So I think just deciding what is helpful for you. I found changing things around at the time of day made a difference. I did some early morning things and had a bigger break in the middle. Some of that shifting times around, you could fit in the same number of people, but in different slots of the day. And that can make a big difference. You can have some longer appointments and some shorter ones and place those around your energy levels in the day and your structure. So I used to find a bit of restructuring made quite a difference. Other stuff I used to do that worked was I had a colleague that we used to job share. Sometimes we used to swap patients when they were starting to make us feel burnt out and heart sinky, to use that old phrase. And we would say, would you be okay if you saw my colleague for a bit? And we would swap them, and I would start off with a lot of enthusiasm for the new but actually it was really good for us and for the patients. That made a big difference. Another technique that can work when you're feeling tired is called the empathy dial. So if you imagine you've got an empathy dial, you can choose to turn it up or down. I found this really useful. So some people like this if you're visual, other people don't, but you can think, okay, my empathy dial's at about a 2 today. Actually, I might notch it up to a 6 for the rest of the afternoon. Or you can feel that you're over involved and you're sort of very connected and you're really drained and you've got that stuff going on at the moment at home, and so you're just going to notch it back for a couple of hours. And that can be really useful because it gives you a bit of control back. And remember, control is one of those things in that in that burnout diagram.
No, I like that. I love the idea of the dial. I think that's fantastic. Okay, we've got a very short amount of time to go through the last couple of questions. How would you raise concerns with team members or managers regarding your concerns with their burnout level, and how the negativity of their burnout level, so another colleague's burnout level, is affecting the workplace? That's a different take on it.
So good to so we get asked a lot of this sort of stuff, and I have to manage a lot of this stuff in medical school as well. But it's good to have some awareness raising stuff in general if you can. I mean, like that burnout story I read, or an article about it, or something, to bring the topic out is sometimes can start off a useful discussion. If that's not possible and it needs to be an upfront conversation with somebody, I would have it in a one-on-one private setting, pick my time, be very careful about that nothing else was involved in the conversation. And then I would start off with, if I was concerned about a person or a colleague, I would say, I've noticed that, blah, 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 specific things, and I'm concerned that, blah, blah, blah. I know this is a bit prescriptive, but I do find it works because I've noticed that it's hard to argue with. I've noticed that, this is happening and this is happening to the patients or the clinic or whatever, or to this person's coming in late or looking exhausted, and I'm concerned that, and then you state your concerns, and then you just need to be able to listen and prepared for whatever response you get. So I think it's to let them have a response to that and to really try to listen to their side of it, and then show that you heard that. So it's key communication here. But I think I've found that I've noticed when I'm concerned that tends to, when said in quite a low-key, caring way, tends to open quite a useful conversation. And it might just be the start of several conversations.
And along that lines, we've had another question come in around something very similar, the culture of a workplace being very toxic towards those who have a different culture and how to address that. So it's a similar style.
I think it is a similar thing, isn't it, of noticing. I mean, I think those group, let's do something to improve our workplace well-being group things, and then you sort of highlight that side of the thing, and then saying, oh, sometimes I think with people of different cultures, it can often be harder to get along, or I think normalizing anything like that's useful. Often practices find when there's people of different cultures, it's harder to get along, rather than saying you're not getting on with her, or can be sort of normalizing language can be really useful. Just thinking back to my last answer as well, I think in terms of persuading people to get on side, linking things to patient safety and risk and patient satisfaction and lack of complaints and all those things are really, really useful. So I had to do a lot of that to get the wellbeing curriculum going in the medical school. So all that evidence around depressed people being making more errors, and so sometimes it needs to be linked to safety and quality of care for any shifts to be made in wellbeing, sadly, in workplaces.
Fiona, is there funding for supervision for nurses in practice as well?
I don't know the answer to that. I really, really wish that there was more funding for supervision. I have no idea why it's not a sort of requirement that everybody has it. I don't know about funding for supervision. That's a very good question.
It'd be something to find out. And one last one here. How do I let go of my own high expectations for myself? It seems to constantly lead to dissatisfaction in myself.
So fantastic self-awareness there, isn't it? And I think we're driven to have that. We train ourselves to have it. We're unfortunately have it reinforced at whatever our health training is. I think expectations can be helpful. Awareness is the first key to that. Deciding that you want a different mindset. That sort of, I'm going to strive for excellence and what's good enough, and actually deciding where that is. Noticing when you're doing it. You might have a voice that comes on. There's techniques. This is the sort of thing that people might go and see a therapist for 3 or 4 sessions and say, I'd like to learn some different ways of thinking about things. But often we'll have like a recurring negative voice that comes in. You need to do better. You should do more. That's and so there's techniques you can use to distance yourself from that. So there's some very specific things like you can hear it said in a cartoon voice. You can you can turn to it and say, thank you, that's not helpful at the moment. You can imagine the words written on a screen and that you just press delete. There's different techniques that you can try. Actually, these things can be really effective in quite a short space of time. So that is a technique, where you can actually learn to change that. And awareness is the first key, because sometimes we're not aware. And actually recognizing where it might come from. Where did that high expectation come from, and why was that? And is that a family-driven thing, and is that something you want to carry on doing, or is that a part of you that you want to let go? It's like, okay, well, that was what I was taught to do, but it's not what I choose to have in my life at the moment. And I think that can be really helpful, because you can choose to let go of that stuff, and you can learn techniques to do it.
Thank you, Fiona. Someone has just written in saying that we can access MPS funding, and I think that's for the nurse practitioners as well, so just to be aware of it. Look, thank you everyone for all your questions. There have been so many, and lots of comments too, which are really lovely to hear, and we'll have a look through at the end, and Fiona will as well. And thank you, Fiona, for your amazing talk.
Thank you.
I think everyone will take something from here that hopefully will help them in their life and in their workplace. And as you've mentioned, they can contact you if they want to talk to you about anything further.
Great.
Thank you. Good evening, everyone.
Bye-bye.